For a patient setup using the Qual Breastboard with the Monarch overhead arm positioner, begin by placing the Qual with Monarch on the couch top. Index the breastboard with the standard 2-pin locating bar for central positioning. For lateral offset positioning, use a sliding locating bar. Once indexed, elevate the breastboard to the desired position using Qual's Sure Set angulation. The device safely supports up to 330 pounds, 150 kilograms, and can be securely elevated to angles from 5 to 25 degrees in 2.5 degree increments. The low angle support allows for angulation from 0 to 15 degrees. Unlock the upper board and lift the low angle support and secure the upper board into the appropriate location along the low angle support. Ensure that the elevation support is clearly docked into the backrest before loading the patient. Never adjust the backboard elevation with the patient's weight upon it. The high angle support allows for angulation from 17.5 to 25 degrees. Separate the high angle support from the upper board and select the appropriate location along the lower board. Ensure that the elevation support is clearly docked into the baseboard's angle locators before loading the patient. Never adjust the breastboard elevation with the patient's weight upon it. Although elevation angles may vary from patient to patient, most departments typically establish a default elevated starting position that's optimal for their CT and LINAC clearance requirements. Prepare the Monarch in its general starting position with head support in place. The Monarch accommodates various CQ medical headrest. For this demonstration, we'll be using the PosiFix wide headrest that comes with the Monarch. Next, select the desired hand grips. The Monarch accepts either the M handle or, for asymmetrical arm setup, the Pro individual hand grips. The same tracking rails are used for both types of hand grips. The hand grips can be adjusted simply by loosening the knobs to adjust the Monarch, and then tightening the knobs to secure the Monarch in its desired position. Assist the patient onto the Qual Breastboard. Have the patient access the board side saddle with the bottom stopper positioned most inferior. Gently turn the patient to align with the breastboard and position the patient laterally as needed. Ensure that the patient's buttocks are on the horizontal base, not up on the board, to prevent the patient from sliding downward afterwards. Gently lay the patient back onto the board, adjusting the Monarch with head support to comfortably meet the patient. Position the patient's arms back towards the hand grips. If using the M handle grips, have the patient reach back as far as they comfortably can. The M handle's docking tabs allow for free movement when the white ring is visible, and can lock when the tabs are pushed in. Ensure that the M handle is docked securely in place. If utilizing the Pro individual hand grips, have the patient reach back as far as each arm comfortably allows, taking advantage of the asymmetrical compatibility of the individual hand grips. Pull up on the hand grips pin to allow for longitudinal adjustment, and simply release the pin to have it lock into place. During this part of the setup, prioritize proper access for the treatment fields, the elimination or reduction of skin folds, and consider gantry clearance for both CT and LINAC. When placing the lateral setup marks upon the patient, use the breastboard's lateral indexing scale to record the intersection point of the lateral laser, thereby providing an additional setup reference point. Position the bottom stopper snugly against the patient. The bottom stopper can be adjusted with a simple lift and lock motion. A leg roll can also be used for enhanced comfort. Record all Qual setup index positions on the designated setup sheet. When the session is complete, slide back the bottom stopper and gently assist the patient off the Qual Breastboard. This setup process is applicable for daily treatment, and the setup sheet serves as an additional benefit and guide for efficient and accurate repositioning. We offer a wall-mounted rack for convenient storage of your Qual Breastboard. Several customization options are available for Qual, including thermoplastic chin straps and thermoplastic breast sheets. Explore our additional training videos for further insights into these customization features. If you need further assistance, CQ Medical offers in-person and live web-based trainings and product demonstrations, and we have clinical specialists around the globe to support all your needs. CQ Medical. Care smarter.